Hey, it's Nick Tominello. I want to show you an advanced rollout progression from the stability ball rollout. Sure, you could do the ab wheel, but I like this one because it adds a little bit different, a different plane of motion in there as well from the ab wheel. So it's the medicine ball rollout. I'm going to show you how it's done, and then I'll give you a few coaching tips. So you want to start off on your knees about hip width apart. This is how we coach it anyway. Hips in, so I'm looking for a straight torso. And then from there, I'm just going to walk the ball out as far as I can, and then walk it back until it's just in front of my eyes. So here's one more rep, and then I'll give you some coaching tips. Out as far as I can. This is harder than it looks. And then pull it back. So the difference from the ab wheel or the stability ball is I got a little bit of this action happening. So a little bit of transverse, a little bit of frontal plane stability, shoulder action going on there. It makes that a little tougher. So you want a nicely inflated medicine ball, otherwise it's kind of tough on your wrists. If you're using a rubber ball, you can use a Dynamax ball. My favorite type of ball to use, not every gym has them, is the sand-filled balls, because then you can use heavier balls and they kind of stay into the ground. They're harder to pull back. In regards to pelvic position, this is important. So again, you're starting leaning in, you're never shifting your butt back like this. And then what I ask the client to do is kind of assume a posterior pelvic tilt. So if your pelvis is a bucket of water, I'd say try to spill the water back that way. So hip bones towards the chin. Because this is an anti-extension exercise, that puts me in a little bit of a flexion bias. And if I feel like I'm losing that posterior tilt and losing that glute squeeze, then I know I've gone too far and I've gone into back extension, and I don't want that. So that's just a little tip. We guess to keep glutes tight, little posterior tilt, nothing, not like this, just a little posterior tilt. And what you say is go as far out as you can without losing that. As soon as you feel like you can't hold that glute squeeze, you've gone out far enough, and then we bring it back in. You don't need to do a lot of reps of that. 5, 6, 7, 8 reps. Start doing sets of 10 and 12. That'll really do it to you.